Preoperative Assessment. بقية الأساتذة طبعا بالثالث بواقع محاضرة أسبوعيا راح يعطوكم principle of surgery like wound healing, wound infection, hemostasis, hemorrhage, and preoperative assessment, post-operative assessment, and surgical infections. هسه نبدأ اليوم محاضرة البري-operative assessment. أنت كطبيب or surgeon should be prepare your patient for surgery. Careful preoperative assessment is fundamental to achieving good surgical outcome. And the same principle apply to both emergency and elective situation. الفرق بين elective situation and emergency يعني elective هي الحالات الباردة والemergency هي حالات الطارئة. The only difference between two being the extent to which preoperative assessment must be compromised when emergency condition require urgent intervention. يعني عادة البريوبراتيف assessment بالإمرجنسي هي محدودة جدا وسريعة لأنه الوقت ما يسمح أنه تأخذ وقتك بالبريوبراتيف assessment مثل ما هي cold case or elective case. When making decision to operate, the risk and potential benefit for surgery should be weighed against those of alternative or no treatment. الجراح لازم يوازن بين العملية وعدم العملية أو عدم العلاج بالنسبة للمريض بالفائدة والخطورة. The purpose of preoperative assessment الفائدة من هذا الاسسمنت اللي قبل العمليه is to prepare patient for surgery نحضر المريض للعمليه. Identify comorbid conditions نشخص الحالات المرضيه اللي يمتلكها المريض اللي تاثر على العمليه ككل. Estimate and minimize preoperative risk by optimizing the patient physical condition. The majority of preoperative assessment for elective surgery take place in preoperative assessment 1 to 2 weeks. عادة تأخذ أسبوع أو أسبوعين to prepare patient for surgery and culminate in the admission immediately prior to or at the morning for surgery. عادة culminate يعني تتركز إنه قبل يوم أو حتى في حالات معينة هو at the morning of surgery the prepare patient for surgery. The first priority to establish the severity and extent of the condition requiring surgery by employing appropriate imaging and other investigation. For example, it is important to know both recurrent laryngeal nerve injury. For example, when we do thyroidectomy and should preoperatively know that the both recurrent laryngeal nerve are functioning prior to thyroid surgery because injury to the recurrent laryngeal nerve is one complication of the thyroid surgery. Okay? The second objective is to identify comorbid condition through careful clinical assessment and through optimization and minimizing preoperative risk. In emergency situation, القضية تختلف. This process is condensed. Judging the time of surgery is crucial. The surgeon must be determined whether which interventions will optimize the patient condition while avoiding deterioration due to unnecessary delay progression of the acute surgical problem. When we prepare your patient should take a complete history from the patient regarding cardiovascular system, respiratory system, regarding the obesity, regarding the nutritional status, regarding the drug history, okay? We take the first one, cardiovascular system. The severity of cardiovascular system should be assessed by history, like taking a history from the patient if he has or had angina, previous myocardial infarction indicates significant coronary artery disease, although bypass grafting, angioplasty, and coronary artery stenting may ameliorate their associated risk. Exertional dyspnea, orthopnea, and paroxysmal nocturnal dyspnea usually indicate left ventricular failure, whilst significant dependent edema may signify right side heart failure. Clinical examination regarding the cardiovascular system should detect any patient have any arrhythmias, any carotid artery problem, heart murmur, hypertension, and sign of cardiac failure. Should seek about any sign of cardiac failure. Antiplatelet agent, take drugs for cardiovascular problem like antiplatelet agent, anticoagulant are widely prescribed for general population and may need to stopped or modified prior to surgery according to the type of surgery. Regarding the respiratory system, should ask about any patient have asthma, have chronic obstructive airway disease, or fibrotic lung disease. Perineural sputum may indicate infective exacerbation of these diseases. In asthmatic patient, previous admission to the ICU, previous hospital admission, as well as steroid dependency indicates severe disease. Functional respiratory reserve is best assessed by exercise tolerance test. For example, how far patient can walk. السئلة ايش قد تمشي حتى تتعب، ايش قد كم درجة تصعد حتى تتعب before needing to be raised because of shortness of breath. Significant dyspnea should be investigated with pulmonary function test. Patient with feature of acute viral respiratory illness should have surgery postponed. يعني نأجل العملية. Any patient have respiratory tract infection, acute respiratory tract infection, because this is due to an increased risk of bronchospasm and susceptibility to post-operative bacterial pneumonia, which is compounded by effect of general anesthesia, which depresses ciliary activity and reducing the clearance of secretions and pathogen. Third one, should ask about smoking. It's very important to take history from the patient about smoking. All patients should be offered support to quit smoking, to quit smoking, because stop smoking, this is very difficult. لازم نعين المريض انه يقطع التدخين, particularly once the decision to operate has been made. Should explain to the patient some of the benefit of the stop smoking, like reduce circulating nicotine and carboxyhemoglobin take hours, while other take weeks or months or even years, the effect of to stop smoking. Despite the significant advantage in the perioperative period, many patients are unwilling to stop smoking prior to and after their surgery. The benefit of stop smoking, the first one is reduced airway hyperreactivity and bronchospasm. Other benefit, reduce sputum production that reduce risk of atelectasis. Improve ciliary function result in an increased sputum clearance, helping to protect against infection. Reduce carboxyhemoglobin, so increase oxygen carrying capacity of the blood. Reduce nicotine-related systemic and coronary vasoconstriction. These all benefit of stop smoking. Alcoholism. Should ask about history of alcoholism for any patient needs surgery, because chronic alcohol abuse and acute alcohol abuse is different. In chronic alcohol abuse, the liver enzyme are induced, so increased hepatic drug metabolism. Consequently, increased doses of hepatically metabolized drug, especially anesthetic drug, are required to achieve therapeutic effect. يعني معناها انه ابو الانستيزيا راح يزيد لنا الدوز اوف anesthetic drugs حتى يعمل التخدير in chronic alcohol abuse. Conversely, in acute alcohol intoxication, على العكس انه acute alcohol intoxication need to reduce anesthetic doses are required. Okay. In addition, the risk of aspiration pneumonia should be anticipated and preventive measure taken. In patients with significant alcohol history, the risk of alcohol-related liver and cardiac disease and coagulopathy should be anticipated. Nutritional status. All patients should have their weight and height measures measurement of the body mass index calculated. It is important to look for signs of malnutrition, such as low body mass index, body weight أقل من 90%, predicted أكثر من 20% of the weight loss, hypoproteinemia and hypoalbuminemia, as they have all related to an increased rate of post-operative complications, especially wound infection and delayed wound healing and pulmonary complication, as well as delayed anastomotic and wound healing. For this reason, it is important to treat malnutrition preoperatively if the time permit. يعني إذا وقت المريض يسمح إنه يصحح النيوتريشنال ستاتس whether malnutrition or obesity لا ضير إنه نصحح قبل العملية. Regarding the obesity على الجانب الآخر, because obese patients have an increased risk of surgery in general, especially anesthesia, and obese patients need special equipment in surgery. Obese patients are at risk of major associated comorbidity. طبعا عادة الobese patients have diabetes, have obstructive sleep apnea, or degenerative joint disease, cardiovascular disease is associated with the obese patient. All these can affect the anesthesia in surgical patients. In practice, the majority of the patient cannot lose weight without support and referral to the GP and dietitian for weight loss programs. Include supervised exercise may be beneficial. وصلنا إلى drug history. Drug history before surgery is very important. Drug history should be recorded prior to admission for surgery. Drugs that require the special consideration in the preoperative period are يعني نسأل على drug history لكنه أكو drug ذات خصوصية like long term steroid therapy. واحد ياخذ steroid بصورة مستمرة. Increased circulating cortisone is important part of the metabolic response to surgical stress. عادة in surgery considered as trauma, and trauma need to metabolic response to the trauma. Steroid is one of the metabolic response hormones. Long-term steroid therapy may result in hypoadrenalism and inability to mount the effect to respond to surgical stress. It is therefore important that patients receive steroid therapy throughout the perioperative period. يعني نزيد الدوز of the steroid during surgery. An increased steroid dose is usually necessary to counter surgical stress. For all but minor procedure, no need to increase the steroid therapy. High dose 100 ملغ of hydrocortisone كل 6 ساعات نعطيها للمريض to need if the risk of hypoadrenalism is compound. Further post-operative complications include infection. Signs of hypoadrenalism include hypotension, shock, hyponatremia, and hyperkalemia. يعني hypotension, shock تقلل الصوديوم وتزيد البوتاسيوم العفو. This is sign of hypoadrenalism. Antiplatelet therapy and anticoagulant should ask about the patient taking antiplatelet, taking anticoagulant, okay, like aspirin, clopidogrel, dipyridamole is common for a patient with cardiovascular disease. هواي ناس كبار تاخذ اسبرين تاخذ كلوبيدوغريل اوكي دايبيريدامول. The risk of thrombotic event, particularly myocardial infarction, if antiplatelet therapy withdrawn should be weighed against the risk of surgical hemorrhage. يعني لازم توازن انه اذا استمريت ممكن العمليه يصير بها bleeding اوكي ولكن ايقاف هذه الدرج لازم should be weighed about risk ولازم discuss with the cardiovascular physician. Where possible, surgery should be postponed and when the patient taking antiplatelet agent, okay, and withdrawn only after consultation with the cardiologist or vascular surgeon. Anticoagulation with warfarin commonly for prevention of embolic event in AF and for treatment for deep vein thrombosis. And pulmonary embolism is also frequently encountered. Third important drugs that chronically used is contraceptive pills. okay, depending on the type of surgery being planned and patient other risk factor for vein thrombosis, it is maybe advisable to discontinue or stop estrogen-containing drug like contraceptive pills or hormone replacement therapy for 4 to 6 weeks before surgery. يعني نأجل العملية 4 إلى 6 أسابيع إذا المريض يأخذ contraceptive pills. Psychiatric drugs have special attention or importance. Tricyclic antidepressant drug and phenothiazine can both cause hypotension, and tricyclic antidepressant also associated with the increase of arrhythmias. In case of phenothiazine, the risk of stopping the medication outweighs the potential benefit, but the anesthetist should be aware for potential complication. يعني خطورة إيقاف الفينوثيازين هي تفوق ال risk of continuation during surgery. It is not essential that tricyclic antidepressant to be stopped preoperative. ما نوقف الترايسايكليك، بس نبلغ الانستيزيا هذا ياخذ tricyclic antidepressant حتى من يصير hypotension يقدر يعالجه. But anesthetist should be alerted. Lithium should be stopped 24 hours prior to surgery, as it mimics sodium potential the action of neuromuscular blocking agent that used during surgery or anesthesia. Monoamine oxidase inhibitor interact with the opiate and vasopressin agent with potential neurological and cardiovascular complication. Ideally, they should be stopped 2 إلى 3 weeks prior to surgery. Lastly, should I ask about any allergy to the drug, to the food. Okay, common example in the surgical practice include antibiotic, iodine-containing drug, adhesive dressing, البلاستر. تسأل المريض عندك حساسية لعلاج معين، تسأل المريض عندك حساسية للبلاستر لأن عملية وتحتاج أنه تضمد المريض بعدين. لاتكس، هذا الماتيريال اللي تتخلى بالجلوفز. Full-blown anaphylactic reaction to latex are rare, but some degree of latex sensitivity is common. Special care has to be taken to clear the patient environment of latex for those with a severe allergic response, as it is common in gloves and surgical and anesthetic equipment. Pregnancy. Ask about history of pregnancy. Elective surgery should be avoided in the first and third trimester of pregnancy. The risk of miscarriage and potential teratogenicity in the first trimester is high in the first trimester of pregnancy. This is usually encountered in relation to the surgery for acute abdomen at this stage. Third trimester of pregnancy, surgery is associated with the significant maternal risk and premature labor. If surgery is necessary, إذا العملية ضرورية بالحمل, it should be undertaking in the second trimester. يعني من الثالث تقريبا إلى السابع. هذا safe period for surgery of elective. إما إذا emergency, no, there is no time for emergency surgery. Previous operation and anesthesia. Should ask about previous surgery, any complication, any anesthetic complication of the surgery prior to this condition. Side effect, reaction should be sought and should be alert the anesthetist to potential anesthetic challenge. اوكي لازم تبلغ الانستيزيا يابا ترى هذا عنده عمليه سابقه وصارت عنده complication like مثلا difficult intubation. اوكي previous major anesthetic complication or suspicious family history. يعني اخوه عنده عمليه وصار مثلا ما قعد من البنش او صارت عنده حراره فائقه بعد العمليه او اثناء العمليه. Because rare inherited abnormalities, for example, pseudocholine esterase deficiency, يسمونها اسمها الثاني سكولين أبنية. Okay, is characterized by prolonged apnea during required prolonged mechanical ventilation in response to short-acting depolarizing muscle relaxant such as hexamethanium chloride. Another condition which is autosomal dominant called malignant hyperpyrexia, which is also a complication of anesthesia, which is inherited as autosomal dominant, characterized by life-threatening hyperpyrexia during and after surgery. Okay, preoperative investigation. خلصنا الهيستوري، خلصنا الاكزامينيشن، خلصنا to be asked about important cardiovascular, respiratory and drug history, any allergy, any about smoking, about nutritional status, about pregnancy, okay, about previous surgery and anesthesia. Then القسم الثاني من preparation of surgery هو preoperative investigation. Preoperative investigation are taken to assess fitness for anesthetic and identify problem amenable to correction prior to surgery. For example, patient سويت له complete blood picture طلع anemia, should be correct the anemia before surgery if the surgery is elective. Preoperative investigation commonly include hematological, biochemical, radiological, cardiovascular assessment, and respiratory assessment. Hematological investigation include full blood count. The majority of the patient undergo surgery will have preoperative full blood count. Oxygen carrying capacity depending on the hemoglobin concentration is important, but platelet and white cell count is also important. Consider in terms of hemostatic capacity. Wherever possible, anemia should be corrected preoperative to optimize oxygen carrying capacity to the tissue. Preoperative blood transfusion should only be considered for hemoglobin concentration below 8 gram per deciliter. يعني ما نعطي blood preoperative إلا إذا الدم مال المريض هو أقل من 8 جرام per deciliter. Surgery with a potential for significant blood loss should have a full blood count, as should those with the sign of hypotension, symptom of the anemia, patient with significant cardiovascular disease, and may compromise oxygen delivery to the tissue, and those with overt or suspected blood loss, for example, cardio-intestinal tract symptoms. Abnormality of elevated white cell count may indicate infectious or hematological disease and should be investigated preoperatively. Platelet is important because thrombocythemia increase platelet increase the risk of DVT, and prophylactic measures should be taken. Thrombocytopenia, when decreased platelet, may need to be corrected to reduce the risk of bleeding because the platelet is very important in hemostasis. In UK, blood transfusion service recommend transfusing of platelet count إذا أقل من 50,000. Okay, for any lumbar puncture, for epidural anesthesia, for endoscopy with biopsy or surgery. So transfusing or نعطي المريض platelet إذا أقل من 50,000. Coagulation screen. The indication for coagulation studies include يعني coagulation نقيس البروثرومبين، نقيس ال INR of the patient, include suspected to have abnormal clotting, anticoagulation therapy, and consideration of epidural anesthesia. When DIC is suspected, disseminated intravascular coagulation, such as in sepsis, fibrinogen degradation product, and D-dimer should be measured. The surgical implication for selective disorder for coagulation are considered below. Biochemical investigation include urea and electrolyte. Analysis of urea and electrolyte is not necessary in young patient. إذا مريضك اللي تريد تسوي له عملية هو young و healthy, no need for to measure urea and electrolyte. Okay? خصوصا إذا عنده minor surgery. Elderly patient and those presenting for major surgery, as well as patient with renal dysfunction, cardiovascular disease, fluid balance problem include dehydration, patient on diuretic therapy or any drug therapy that may affect electrolyte balance or renal function, should all have routine blood urea and electrolyte. يعني نسوي blood urea كل مريض عنده major surgery, elderly patient, cardiovascular disease, patient with abnormal fluid balance like dehydration, patient with with diuretic therapy, ياخذ diuretic therapy, any patient with the renal problems, okay? نسوي له blood and electrolyte. liver function test نقيس البيليروبين direct و indirect, liver enzyme. all patient with non-liver disease, يعني patient have chronic liver disease, significant alcohol consumption or sign of liver disease should have liver function test. يعني أي مريض عنده sign of chronic liver disease, alcohol abuse. Okay. Cardiovascular investigation include ECG, echo, and exercise test. ECG is very limited value in predicting the risk of ischemic event and generally should only be performed in elderly patient أكثر من 65 سنة to detect occult rhythm disorder and sign of previous cardiac event. In young patient, ECG should be restricted to those of sign of or non-case of cardiovascular disease and those with risk factor for ischemic heart disease. يعني باليانج بيشنت اذا ما عنده ريسك فاكتور ما عنده كارديوفاسكولار بالهيستوري اللي اخذته ما يحتاج اي سي جي. روتين تشيست اكس راي should only be performed in context of cardiovascular assessment where congestive heart failure is suspected. يعني مريض بالهيستوري اعطاك هيستوري عنده congestive heart failure لا التشيست اكس راي كلش مهمه عند ذول المريض because show cardiomegaly. Echo is used to assess the cardiac function, خصوصا left ventricular ejection fraction in particular, and may be indicated prior to major surgery in patients with suspected valvular heart disease and heart failure. Cardiopulmonary exercise test is dynamic test for cardiopulmonary reserve. This is used selectively to help select patients with high risk surgery such as thoracic surgery, vascular surgery, cardiac surgery, need exercise test. Regarding the respiratory investigation, patient with the purulent sputum should have a chest infection, should have a sputum culture and antibiotic sensitivity performed prior to surgery. Preoperative chest X-ray is useful baseline in patient with none or suspected pulmonary disease. May be demonstrate consultation, atelectasis, and pleural effusion. All these finding in chest X-ray with this disease should be known before surgery. Routine chest X-ray is not indicated to have poor sensitivity to detect the new respiratory disease. يعني upper respiratory tract infection may be normal chest X-ray in the beginning of the infection. Pulmonary function tests are useful to guide severity and reversibility of the obstructive component of the respiratory disease. The last thing in the preoperative assessment after taking history and examination and do a routine investigation in a preoperative assessment should take informed consent. Okay? Informed consent هو الموافقة، هو عقد بين المريض والكادر الطبي برئاسة الجراح. Informed consent is essential to practice for surgery and has to be obtained for surgical procedure. مو شرط إلا عملية. Any intervention, any treatment should take a patient informed consent. يعني لازم تاخذ موافقته بالانفستيجيشن، بالسكرينينج تيست، بالسيرجري، even بالانفستيجيشن فور ريسيرش، حتى بالبحث الطبي هم لازم تاخذ موافقة المريض. Capacity exists if the patient can understand and retain the information presented. يعني الموافقة مو توقيع فقط وإنما تفهم المريض على البروسيجر، على الكومبليكيشن، even حتى فد نبذة مختصرة أنت شو راح تسوي له، أوكي؟ تقعده وتفهمه شو تسوي، ممكن شنو اللي راح يصير بالعملية، ايش قد تطول العملية، ممكن شنو اللي يصير من كومبليكيشن بالعملية، ولازم عنده إدراك بهذه الأمور. طبعا المريض وليس ذوي المريض. What about any implications including risk and benefit of the options. يعني تناقش الاوبشنز اوف ذا تريتمنت، يعني اذا ما تسوي عمليه ممكن هيك يصير، اذا اعطيتك علاج ممكن انه تطيب لكنه العمليه افضل. اوكي، يعني تناقش مع المريض الاوبشنز اوف ذا تريتمنت. اوكي، تواجهنا مشكله انه there is circumstances or sometimes there is environment where the capacity not to consent may be not exist. يعني يمتى الظروف اللي يكون بها المريض غير مؤهل لإعطاء موافقته. اوكي، مثل ايش؟ مثل children. ما يقدر يعني يفتهم انه شنو المخاطر، شنو البنفيت اوف ذا سيرجري، شنو الكومبليكيشن، لذلك لازم ذويه هو اللي يوقع. mental illness، واحد متخلف هم ما يقدر ياخذ قرار بالعمليه. fluctuating or irreversible loss of cognitive function، واحد ديمنشيه، اوكي، رجل كبير بالسن، هم لازم ذويه اللي يشاركونك باتخاذ القرار. patient subjected to undue correction، يعني المرضى اللي ما عندهم مؤهلات اتخاذ القرار، مثل ايش؟ مثل مريض عنده مثلا موقوف، اوكي، موقوف، هم ممكن هذا يقول لك قرار انه بس يريد يتخلص من الحاله اللي بيها هو. Okay, this is the preoperative assessment for any patient with surgical requirement. خلصت محاضرتنا. قد تكون يعني المفروض يعني فهم المحاضرة إذا فيس تو فيس وسؤال وجواب أفضل، وحضوركم كلش 88 طالب كلش فقير. قد يكون يعني الأساتذة يسوي لكم كويزات، أنتم طلبة يعني الأسسمنت، الحضور جدا مهم، وكذلك الكويزات المفاجئة ممكن يسوي لكم إياها. أوكي، محاضرة جاية تكون على البوست أوبراتيف كير، يعني قبل العملية شو نسوي له، والمحاضرة الثانية هي بعد العملية شو نسوي له، بوست أوبراتيف كير. شكرا جزيلا.